Hey guys, how are you all? Welcome back to Mbbs YouTube channel. So today in this video we are discussing about introduction of fractures. So why we have to learn these fractures and everything means because when we are working in our hospital, most commonly, that means extremely most commonly, we can see like some trauma and non-trauma settings. For example, if any patient have any accident, we can see the fractures. If any child is fall means while playing, we can see the fractures. So this is a fracture is the most common thing. Okay, so why we have to know? Because it causes disability and work loss and morbidity also. So that's why we have to prevent some long-term complications. That's why we want to know everything about fractures. Okay, as a doctor, we have to know the definition of the fracture. The fracture means it's like some disruption or break in continuity of bone resulting from a secondary like trauma, pathological weakening or stress. For example, you can see here this is the forearm bones, that means radial and ulna. These bones are continuity bones. If any disruption or any break happen in this bone in between or somewhere, then we can call that is fracture. Okay, this fracture, why these fractures will happen? Because of some trauma or because of some pathological conditions like osteoporosis or osteopetrosis, like different types of pathological conditions, or tumor or cancer, this type of things, or some of the stress means some like repetitive movements or collisions. This type of things can cause fracture. Okay, so now we are going to discuss about classification of fractures. What is classification? Classification is based on 4 types, but we will go step by step. First classification will be like skin involvement. Based on skin involvement, the skin involvement divided into 2 types. First one, simple and compound. Simple, also called closed. Closed means that fracture is not communicating with skin, that means layers and muscle. Okay, so closed one means its skin intact. In compound means it open fracture, because the fracture is the fracture happen after fracture, that fracture is communicating to the skin, okay, and are tearing the skin. This thing we call open fracture. The bone is communicates with the external environment. When the bone is communicating the external environment, it can cause infection, because of when that bone is attaching to the communicating to the external environment, it can cause infection. So okay, now second one, based on completeness. Completeness means that bone, it's like entire cross section of the bone is broken. If totally that bone is broken means, then we call it's like complete fracture. Incomplete fracture means it's partially some line happen or partially broken. Okay, when it's coming to third classification, it's based on patterns or direction of fracture lines. If any fracture happen, we have to know the types of fractures. If you know the types of fractures, we can do the surgical management. And if you are applying the cast, and where in posterior location, in anterior, in lateral, in medial, where you have to apply the cast, everything we can understand. So that's why first we have to discuss bone fractures. Okay, so total how many fractures, how many types of bone fractures we have? Total 9 types of bone fractures we have. So first one, if you are seeing this image here, if you're seeing this image here, you can see, okay, first one we are seeing the transverse fracture. Transverse fracture means, for example, this is femur bone, that means long bone. We call this is the head, and this one neck. This whole part we call epiphysis, this one metaphysis, and this total part diaphysis or shaft. okay. But here in this, when we are interpreting the fracture or X-ray, we have to tell that is proximal part or distal part, and in proximal part in which we have some different parts. So based on that we have to convey the fracture interpretation, okay. First, in transverse fracture, what are the things we can observe? In transverse fracture, that line will be horizontal. That line will be horizontal like this, okay. That horizontal fracture line is known as transverse fracture. When it's coming to second image, in second image you can see some line is passing up like this, okay. This thing we call this line is going passing longitudinally, so this longitudinally we call this is linear fracture, okay. Third one, this is in shaft, in diaphysis region we can see some obliquely means it's going to diagonal. The diagonal line you can see, in the diagonal line across the bone means you can see that is oblique. In oblique it's divided into two parts, displaced and non-displaced, okay. Non-displaced means it's that fragments is not changing the position, in same position is there, then it's oblique fracture and non-displaced fragments, okay. Next one, it's like oblique fracture but these fragments are displaced, like that we have to interpret it, okay. When it's coming to fifth image, this is spiral fracture. This spiral fracture means that fracture will be like this, okay. For example, this is diaphysis. In the diaphysis, that fracture will be like this, okay. That means it's spiral part, it twisted because this spiral fracture happened because of twisted injuries, okay. If any person any twisting type injury happened means we can see that is spiral fracture, okay. Next one, we are seeing green stick. Green stick means it's like a normal like drumstick, how when we are breaking the stick how it will break, same to same it will form some bends or cracks without breaking the complete, okay, like this. This bone totally is broken means no, because in green stick we can see some bending or cracks without breaking of the complete bone, okay. Next one, we are seeing the comminuted bone fracture. Comminuted bone fracture means it's like because of high trauma accidents in the things we can see this type of fracture, that bone fragments it's like totally shattered means it's broken into small parts into multiple pieces, and it's like that it's going to somewhere, okay. So this is like comminuted fracture. We discussed transverse fracture, linear fracture, oblique and non-displaced fracture, oblique displaced fracture, spiral fracture, green stick, and comminuted. After this introduction, I will show you some X-ray. In that X-ray, you can easily differentiate the types of fractures, okay. Next, we are discussing about segmental fracture. I don't have image, okay. For example, this is tibial bone. In this tibial bone we can see the how that segmental fracture will be. That segmental fracture will be like this. That means it will break into like two or more fracture lines we can see, an isolated bone, okay. So this type of fracture if you are seeing means that it will comes in segmental fracture. Next one, same, this one also tibial bone. In this tibial bone what will happen, now I am discussing about this is segmental fracture, Okay, this one impacted fracture. Impacted fracture means that bone, this is the normal bone, that bone is coming to another bone like this. That means it's broke, it's like it's got broke, then after it's going to, that fragment is going to another bone. So this thing we call impacted fracture. Okay, so these are the types of fractures, and some other types also there. Maybe in X-ray I am going to tell that things. Okay, next classification based on displacement. Displacement means that fragments is misaligned or separated, it will be like displaced. Non-displaced means that fragments remains aligned. Okay, next one, based on bone exposed. If that bone is coming out of the skin, okay, it's communicating to the external environment, then we call that is open fracture. That for open fracture we have to classify it by, we have to classify it by Gustelow-Anderson classification. This is very important in orthopedic department. Okay, so in open fracture we can follow the Gustelow-Anderson classification. This classification we will discuss in when we are discussing about open fractures. Next one, closed fracture. In closed fracture we can see based on types of fractures we already discussed. In closed fracture, based on types of fractures we have to do management and these things. Okay, so now etiology of fractures. Etiology means causes of fractures. I divided into three types. First one, traumatic. Traumatic means if any person is falled, we can see that traumatic fracture, and motor vehicle accidents and direct blow or force. Okay, so this type of things we can see. This is the causes of traumatic. Next, pathologic. In pathological conditions we can see osteoporosis, tumors, if any person has osteomalacia or Paget's disease. This type of pathological conditions can cause fractures. Third one, stress. Stress means if the bone muscles are fatigued, then it can cause fractures. And repetitive movements. Repetitive movements where we can see in athletes and military recruits. So because of repetitive movements it can cause stress and it can cause fractures. Okay, so now we are going to discuss about sign and symptoms of fractures. Mostly first one we can see the pain also known as rubor. Next, swelling, tumor. Next, deformity we can see, and functionally, that means loss of function, and crepitus, that means some sound while moving we can see some crepitus sounds, and abnormal mobility, and bruising, and ecchymosis, and neurovascular compromise also we can see. Neurovascular compromise means when fracture happen, automatically surrounding that blood vessels can rupture, a tear, or that nerves can get stretched, and it can leads to neuropexia. Sorry. Okay. Next, how we can diagnose the fracture? First one, clinical evaluation. In clinical evaluation we have to understand how that mechanism of injury happened. Based on that injury we can easily find out the fracture without imaging. Okay, so next, and some associated symptoms also, and like pulseless, where that fracture happened, everything we can easily understand. In physical examination we can say deformity and tenderness and range of motion decreased, and neurovascular status. When it's coming to imaging, in imaging mostly we have to understand the X-ray. If you know how to interpret the X-ray, easily you can find out the that fracture types and everything. But before knowing fracture, before knowing X-ray, we have to follow the 2 rule. That means this is 2 rule means everything, like 4 things we have to think about that. That 4 things. First one, 2 sides. 2 sides means bilateral part. Next one, 2 views, that means anterior, posterior plus lateral. Third one, 2 joints, that means above the joint and below the joint we have to check. Next, 2 times, that means before the reduction and after the reduction of the fracture. Okay, Next, CT scan. In scan, if any fracture like complex fractures, that means we want to see the surrounding of the bone or vertebra, that time we have to do CT scan. In CT scan mostly we are going to do for pelvic and spine. Okay, next MRI scan. MRI scan, if any soft tissue injuries are occurred or some stress fractures if you are seeing, means that time we have to do some ligaments, soft tissue, this type of things we have to do MRI, like tendon, these things. Bone scan, if we are if any patient we are suspecting like detecting like pathological fractures, a tumor or some biopsy tests and some bone density, if we want to know, means we have to do these things. And another thing, if any females are using any medication for leuprolide, that means gonadotropin releasing hormone, and some tumor type of drugs also can cause decreasing bone density. Okay, this leuprolide means we are using for fibroid type patients. If any patient using this type of medication, means every 6 months we have to check bone density. Okay, so that time we have to do bone scan. Next, we are going to see the management, how we can manage. This is the main part, because when I am doing accidental emergency department, the patient is coming, I don't know what I have to do, but when I know the management step-by-step approach, then easily I can do the management. Okay, for example, first in management we have to follow the primary survey. Primary survey means A, B, C, D, E. A means airway, breathing, circulation and disability and exposure. These things we have to follow. After this primary survey, we have to do, if any patient have emergency patient, means first we have to immobilize the patient. If any fracture you are suspecting, means we have to immobilize the patient, because if we are not immobilizing, means it can tear, it can stretch the nerve, it can tear the blood vessels and it can cause the hemorrhage. Okay, and it can cause the decreasing perfusion. So this type of things we don't want to go through, that's why we have to do immobilization. Then after we have to control the bleeding. How? We have to apply some pressure and we have to control the bleeding. Next, we have to manage the pain with morphine or based on patient age, and we can give some analgesics. Next, we have to assess and restore the neurovascular function. Okay, then after we have to cover the open fracture with sterile dressing. If I already told, open fracture means it's communicating with external environment, so it can cause risk of infection. That's why we have to do sterile dressing. Next, if non-emergency patient, what we have to do? We have to restore the alignment. In closed fracture means we have to do manual manipulation. Manual manipulation means we have to check the X-ray and we have to apply the cast. And before apply the cast, we have to do traction and we have to know the degrees and based on bone fracture. Okay. Next, in open fracture we have to restore alignment with surgical exposure. Next one, immobilization. How we can do immobilization? With cast, and we can use some splints, we can use some traction, we can use some external fixators. How we can fix? In internal fixation, for internal fixation we have to use some screws, plates and rods and intramedullary nailing. In external fixation we can use some external fixators for unstable and or open fracture. Now we are going to see the complications. The complications are divided into two types, early and late. In early complication we can see hemorrhage and neurovascular injury and compartment syndrome and fat embolism and infection, open fracture. Hemorrhage, because of rupture of blood vessels, hemorrhage is happening. Okay, neurovascular injury, that now getting stretched, that's why that neurovascular injury happening. Compartment syndrome, when bleeding hemorrhage is happening, automatic their decreasing blood, we can see the decreased perfusion. Because of decreased blood perfusion, you can see that edema and hemorrhage. That edema hemorrhage can press the fascia, and that compartments can cause increasing the pressure, and that parts will get ischemia, and ischemia can cause necrosis. This type of things we can call compartment syndrome. Fat embolism, if this is the golden point, if any person have long bone fracture, that means pelvic bone or femur bone or femoral neck, okay, or intertrochanter fracture, this type of fractures can cause fat embolism, because that medullary, that intramedullary fat, that marrow, that bone marrow can go to the bone marrow can mixed in blood vessels, so it can cause the fat embolism. Okay, so this is the one thing. We will discuss this pathological conditions in our next videos. And some infections, open fracture. Okay, in late complications we can see malunion and non-union, delayed union and avascular necrosis, and joint stiffness or contracture, and chronic osteomyelitis also we can see in late complication. Now rehabilitation. In rehabilitation we have to start after surgery, after cast applying, we have to start early mobilization to prevent stiffness. If you are keeping like that hand without moving, it can cause stiffness. So that's why we have to do physiotherapy. In physiotherapy they will teach some mild exercise, stretching and these things. Okay, and some functional bracing, and we can use some pain control, and we have to use some nutritional supplements like calcium, vitamin D and proteins. Now this is the main part. X-ray. How we can interpret the X-ray? Okay, first last one X-ray I will give you, so you have to see that X-ray and you have to mention in comment section, okay, that answer, how you can interpret that thing. Now first one, if you are seeing this X-ray here, this X-ray is transverse fracture of tibia, because this is fibula. Okay, okay, this one tibula, this one tibial bone, this one fibula. Okay, here if you are seeing this image, here you can see some line like this type of things. You can tell transverse fracture of tibia, because this fracture is passes at right angles to the shaft of the long bone, so that's why this is transverse fracture of tibia. Okay, next, same to same, here we can see this is spiral fracture. I already told how the spiral fracture will happen, because of twisted injury. Okay, this is spiral fracture. In this spiral fracture of tibia we are seeing here, because of twisted injury, and that fracture line is that spirals along the shaft of the long bone. Okay, next one, yeah, this is, we can see this is like metatarsal. In this metatarsal you can see some oblique fracture. Okay, this is oblique fracture. So oblique fracture of metatarsal, this fracture is passes at an angle like oblique to the shaft of the long bone. Okay, okay, what you are seeing here, this is tibial bone, this one fibula bone. In this tibia fibula bone, here you can see sagittal fracture. This one sagittal fracture. The fracture line passes longitudinally along the long bone shaft in the sagittal plane. Okay, next one, we are seeing here comminuted fracture of humerus. This is humerus bone. In humerus bone you can see here one fragment is there, here one fragment, here one fragment, here, and here. This everything like that fracture is comminuted. That means that proximal, this one proximal part of the humerus, that proximal humeral shaft fracture with bone shattering. This total bones got shattered, and because this type of comminuted fracture will happen because of high force of injury. Okay, so this one comminuted fracture. Next, if you are seeing this image, you can see this is calcaneus bone. Yeah, this is calcaneus bone. In calcaneus bone, what you are seeing means here we have some fracture like this. Okay, that means it's not in one direction, so we can call this thing multi-directional fracture of calcaneus, because the fracture line is passes through the calcaneus body in the both of coronal and axial plane. Okay, so this is the next one. Same to same, this is tibial bone, fibula. Here you can see the some segmental fracture of the tibia and fibula. The segmental means what I told, two or more we can see fracture lines or fracture fragments. Okay, because the bones are have separated from the both like proximal and distal portion of the tibial and fractural shaft. Okay, so here this one segmental fracture. Okay, so now this is your question. I want to know what type of fracture is this. Okay, that's all. So here today we discussed about some introduction of fractures. This fracture I told transverse fracture of the tibia, this one spiral fracture of the tibia, this one oblique fracture of the metatarsal, this one sagittal fracture of the tibia, this one proximal humeral fracture, that is comminuted fracture, this one multi-directional calcaneus fracture, this one segmental fracture of the tibia and fibula. And what about this thing? This is your question, so you can answer me in comment section. Okay, so we will meet in our next video. Like, share and subscribe.